So I'm going to keep this at a really high level because the detail of institution requirements is all in the manual, and to go through it, you would fall asleep. So as you said, I'm the CMO and the DIO for San Ysidro Health. San Ysidro Health is an FQHC located in San Diego, started right at the border, and we're excited because we started in 1969, and so we're celebrating our 50th anniversary this year. Started from a little 2-room volunteer, doctors from UCSD, and now we're up to close to 97,000 patients and 15 sites, 15 clinics, and then we have about 30-some other sites. So we've been active in workforce development for over 20 years. As I mentioned earlier, we actually are a continuity site for a residency program in family medicine, and we also do dental residency program. The dental residency program, again, we're sort of the continuity site, and it's through the NYU Langone dental residency. So we train family medicine physicians, and we also train pediatric dental residents. The dental residents get a great experience because they work out of 2 sites. One site is to get sort of their bread and butter dental, and the other site is where they actually Brady Children's Hospital leases a space, so we're sort of connected to the hospital, and they get training in all the high-need pediatric patients. So those patients with CP or heart conditions, if it's pediatric and they need a surgery, have to take care of their caries before they can have surgery. So we provide the care for that. Again, we have 2 different models of residency program. One is a continuity, and then the other is what we're working on right now as a sponsoring institute. So our continuity site model, we're the participating site. We have an affiliation with Scripps Mercy Hospital, UCSD, and then San Ysidro Health. So it's a 3-way collaboration. The funding is very interesting. So as a sponsoring institute, it goes through Scripps. However, we completely support the continuity side, and we get didactic, some of it through CPCA. So it's a nice model because it's not really dependent on any one source of funding. So when you hear all these things and people get, a little worried, oh, there's no teaching health center funding, or there's not this or that, we sort of, the funding comes different ways. So it's a nice model. It actually was put into place before the whole teaching health center type funding came about. So it's a community-based program with emphasis on training primary care physicians for underserved areas. Our goal is to have residents reflect the community. They've graduated 116 graduates. I was the 2nd class that started, so I'm one of those. We have 50% of our residents are underrepresented minorities, and 45 have stayed in the local FQHCs. Many more have stayed in the area or FQHCs outside of San Diego. San Ysidro alone has hired about 35 of these residents. So the reason we have been able to grow so quickly is because we have workforce development in our organization. The sponsoring institute model. So this is now what we're working on right now. We're developing an internal medicine program with an emphasis on training primary care internal medicine physicians who will practice in the area of the underserved. It's going to be interesting how this works out. Family medicine, they tend to, they want to stay in primary. Obviously, they're primary care physicians. Internists want to specialize. So we're really worked hard on building a program that would attract those that may go into primary care. We know that once they get in, they may decide to specialize, and we may not retain any of the physicians, but we want them to at least have that experience and see if we can attract physicians that do that. We've been, my boss asked me recently, he said, for the family medicine residency, are you involved at all in the recruitment? And I said, no, I'm not. I have never, except as a resident there when I was a chief resident, I've never been involved in the interviews for applicants because our program director for the family medicine program is so mission-driven, so committed to the same mission we have that we've never had to have any involvement in the recruiting of residents. She picks the right residents that have the same mission as us. So when we thought about that, developing this program, that we want to make sure in our recruitment efforts we have that same selection process and we really look for those that possibly would want to work in our area. And even if they specialize, if they want to stay in the community. So again, our participating sites are the same institutions, Scripps and UCSD. So this time we'll be the sponsoring institute, and Scripps now is the participating site as well as UCSD. We've already received our accreditation as a sponsoring institute. We got that letter in October, but it was effective July. We completed our site visit in December. Really quick process. We've been on a quick timeline. So we actually submitted our specialty application in the very end of October, like October 28th. And within 2 weeks, we already had a site visit date, and 4 weeks later, we had our site visit. So it moved very quickly, much quicker than I was expecting. So our site visit occurred in December, went well, I think. So we're just waiting for that. I know, our own program director told us that's one thing we were missing. But
told the reviewer.
He told the reviewer, yeah.
Volunteer.
One little thing we were missing.
Yeah.
And he was already done with his interview. So we're very honest at Ysidro.
Yes.
So we're awaiting notification the first week of April. I think it's April 4th and 6th is the committee meeting. So what does it mean to become a sponsoring institute? I know you went over some of the process. I'm going to review the key sponsoring institution requirements at a very high level and maybe point out some of the areas that that just need to be aware of. The general process we went through, what our experience was, some of the challenges, and then just some of the positive outcomes or surprises that we encountered. So the requirements. The ACGME Institutional Requirements Manual, that's key. I have it with me all the time. It's printed. It's on my desk. You can download these from ACGME, and it'll tell you what the requirements are to be a sponsoring institute. Read it and know it, because it's going to be your Bible going forward. Identifying key personnel. Designated institutional official, which is me. I have authority and responsibility over the administration of the residency program. Again, only our residency program, so I have no authority over the family medicine residency program, but I will have authority over our internal medicine. That being said, I have a very, very close relationship with the family medicine residency because, first of all, I was a graduate of it, but we just partner a lot. We've actually strengthened that partnership in the recent years by allowing, I sort of donate some of our physicians. I allow 1.0, so 10 different providers a half day a week where they can actually precept with the residency program. I see it as a benefit for the residency program, as a retention tool for the physicians. When we're recruiting, they say, hey, you have a residency program, can I teach? And I would say, I have no say over that. You have to be selected by the program director from the program, but it's a great retention tool for them because people want to teach, and it's like a little half day, not off for them because they're still in clinic, but it's a different role. And it also, just for the organization, we saw, since we started doing it, more of our residents stayed on in the organization, so they started feeling more connected. However, with this program, it will be our employees that will be the attendees. Governing body, so identify the need for a residency program to your board. It's really important that your governing body, and if you're FQHCs, obviously it's your board. Every chance we get, we talk about workforce development to our board. They know the success we've had with just being a continuity site for the family medicine residency, and they're so. When we went to them and said, hey, we want to do an internal medicine residency, you know, at first they were saying internal medicine, we're not family medicine, we see everybody, but we brought it forth because we have a PACE program, and I don't know if anyone knows anything about PACE. It's the program All-Inclusive Care for the Elderly, where really you need those physicians that want to see the geriatric population. RFCs, they want to, family medicine physicians, they want to see children and OB, and so what we're finding with our graduates when they stay on, they love the organization, but they keep saying, I don't see enough P's, I don't see enough OB, And we have a lot of adult patients. We have an aging adult population. So that when we talked about this to our board, when we said internal medicine, it made sense. They were prepared. They were ready. Immediately they approved and were on board with us starting an internal medicine program. The GMEC. The GMEC committee is a Graduate Medical Education Committee. You have to form that committee. Members include myself, the DIO, the program director, quality or safety officer. At least if you only sponsor one institute, one residency program, you also need at least one individual from a different department outside that may also be involved in graduate education, so, or should be involved. So we actually selected a program director from the family medicine program, and then we selected a DIO from the Scripps Institution. So we were able to include all of them on our GMET. And once you're active, you need 2 peer-selected residents. So those are the first steps you need to do in order to start your application. Oh, thanks. You have to look at your institutional resources to make sure that you have financial support and protected time for your key players. You don't want your faculty trying to do their regular job and do this on the side. We really have to protect their time, and you have to prove financial support for the time of the program director and the key faculty, core faculty. Faculty development, you know, if you're able to hire people with a lot of experience, great. We didn't have that luxury, so we had some that had some experience, but we still need to develop them, and that's part of the requirements too. You have to have development of your faculty. So I keep my eye out for different trainings that are going on and make sure to send them to the training. Educational resources and access to medical literature. That was a little stumper for us because we don't have a medical library. We don't have a sim lab. We don't have some of the stuff that they needed. So right away we started reaching out and getting, working with our participating sites who had sim labs, who had medical libraries that they were allowing us to use. And so it made it a lot easier than us starting up everything from scratch. Support services and system, that basically means that you understand your institution is there to let the residents learn. They're not going to be, you know, filing charts, well, not that there's charts anymore, but they're not going to be drawing blood and doing administrative type work, that you have the support in place that meets all the needs they need to do their job. And then the GMEC. GMEC has way too many responsibilities to go through, but basically it's the oversight of the program and gets pretty much involved with everything needed to run the program. Learning and working environment. You need to, when you're doing this part of the application, you need to have something in place that allows the residents so that you can prove that your residents have a way of giving feedback of the program or issues that arise, that they have a way of giving that feedback, and then if needed, it can be confidential. We are lucky. We already have a hotline for compliance. We have a risk management system. We have incident reporting. So all of this was sort of in place for us so we could prove that we could meet this requirement. Sponsoring Institute also has to oversee and document resident engagement in safety, QI, and transitions of care. Again, most of this we had in place. Transitions of care is a little more difficult, but we put in some policies for that. But we have a safety committee. We have a lot of quality improvement. We do lean training we've already trained over 100 of our employees on Lean Six Sigma. So we really work on integrating the residents into the processes that we already had in place. They also have to oversee work hours, fatigue mitigation, and sleep facilities. All policies that we just basically wrote out, what the work hours were, you know, how we're going to handle fatigue, and we made sure in our manuals that we included areas of sleep facilities. And then education and monitoring of professionalism. Sounds easy, you know, you just assume people are going to be professional. Not necessarily. I mean, anybody who's in a clinic knows that you're surprised at what some of your professionals do sometimes, but it's really important on your application that you have, not only on the application, but that you will educate your residents and your faculty about professionalism, that you'll model that, and that you're going to be monitoring it. So we have right up front, we developed a training session on this during the orientation week, and then we'll have different didactics revolving around that. Education and monitoring of well-being. Again, you need to make sure your residents are well and healthy. So that you're not only your residents, but their faculty, that they're all trained on signs and symptoms of burnout, depression, substance abuse, that you have self-screening tools for the residents, that they have access to mental health care 24/7, and that they have the basic needs. So when they're in the hospital overnight, that there's food available, that there's sleep quarters, that they're safe, that, you know, if they are tired and they need a taxi voucher, whatever it may be, that you have all of this in place, and it's all on the application that you submit how you're going to meet these different requirements. I'm not going to go through these, so this is just a partial list of all the policies and procedures that you need to get into place in order to, you have to check off that you have these policies. I don't think you submit all of them, but you check a box saying that you have these policies available. All of the policies and procedures really involve your HR department, because you can't, for us, we can't offer anything for one employee that we don't offer for another. So we really had to work closely together to make sure that we met the needs of the residency and our employees. The quality department is great because they just filled out that part of the application for me, and all the things that they have in place already going on. And then the executive team has to be on board for all of this. So the general process, again, it's just really meeting with your executive team and your board and saying, this is what we want to do. We have a need. We know it's internal medicine we need, because that's just a gap that we have in our environment. So it was easy to come to an agreement that we were going to move forward with this. Identifying key partners. That was an easy part for us because we already had that three-way partnership going on, so it was easy for us to do that. Specialty was probably a little easier for me than it may be for some people. The person I selected to do in the hospital to do the teaching for inpatient immediately said, I'll find all the specialists for you. Wow. I wanna be involved in this. And she literally was calling me, come meet so-and-so, and also, I had done my training in that same hospital, so I knew the specialist too. So it was a really easy process for me. I will not say that's going to be easy for everybody. So if you don't already have those strong bonds, it may be a little bit difficult. You need to account for some time for that. Then get that application, download it, get your manual, and just look at the two and make sure that you're meeting the requirements. So for every question, as you look at it, look at the manual and say, what will meet, how can I answer this to meet this requirement? Again, involve your HR and quality department early in the process, because you really need their input on the policies and procedures. And then just complete the application and submit it. Sounds easy, huh? Not so easy, but it's doable. I think we did ours pretty quickly. It was just,
well, in fairness, her CEO,
I know.
she's amazing, but her CEO called in, I want to say mid-May. We want to do a sponsoring institution application. It was right, and we were going for the June 19th submission deadline, and which is way too quick. Okay, it's a 6-month process. We did it about a month, and then 3 days later, called and said, "Can you tell me about this Song Brown application process?" And it was due, I want to say that was
the following Monday.
It was due the following Monday.
Yeah.
And I'm like, Kevin, this is not possible. And he's like, yeah, we're going to do it anyway.
Yeah.
And that's how you and I were thrown into the fire together.
Yeah.
And they were the #1
I think we were,
applicant.
Yeah,
they rock. She rocks.
No, I think it's our partnership in our community, and, you know, we just had everything sort of going for us, and the work just to put it together. And look, you know, we all have key things in our organization. You just need to highlight them. And if you can highlight that, it works out. But, yeah, we had like 4 days to finish that Song Brown application and get it in. I was almost hoping we didn't get it, because then I wouldn't have to worry about the rest of the process. But we got it, and so we're moving forward. So let's see. So our experience, obviously, we got we got our key partners involved. The scripts and the program director is actually from UCSD, but he has been involved with our organization for, I don't know, maybe 20 some years. He used to be an employee. He left. When he came back, he went to UCSD in the geriatric department. But for the last 15 years, he's spent 1/2 day a week at our organization providing care. So he knows our community and will be wonderful for the program. Meeting with the partners. Account for that time, because you can't just be on the phone talking to them. You go down and meet with them and give them respect, let them know what you're up to. Obviously, we worked with a consultant for the application, which was a huge benefit because I had no idea where to start. And I'm a family medicine physician, so I spent many hours trying to figure out what an internal medicine does and the terms to use for an internal medicine physician. And then identify the GMAC and held biweekly meetings with annotated minutes for easy submission. So you have to have the regular GMAC meetings in the beginning. They're pretty frequently. We were trying to pass all of those policies and get everything into place within a couple of months. So we had them fairly frequently. I even did them from, I was away out of, I was on vacation.
As I said, she rocked. She was telling him some great. That was nuts. But quick thing on that, that's an example of the art versus the science, because what I don't think it says anywhere in the regs is that you have to show that each policy was approved independently of the other policies and documented in the minutes.
Right.
How would you know that unless you've gotten dinged on it before?
Right.
Okay. So
we went policy every couple of weeks. We went through 5, 6 policies and got them approved. And we made sure that we annotated them so that with the minutes. And so when you're submitting, the reviewers can quickly see that you're meeting different requirements, that you're doing what you need to do at your GMAC meeting. Challenges. Again, hospital partners was not an issue for me, but from a lot of people that I've spoken to, this is where they have problems. So if you don't have that relationship now, start working on it. Competing space at hospitals for rotations, that was an issue. High level, everybody, yes, what do you need? We're going to help you. When you start working on the people that actually have to find the space, find the time for the rotation, then it gets a little bit more difficult because there's other programs in the hospitals that need ICU rotations. They need the sleep quarters. So there's some competing needs going on there. In fact, I'm meeting with our family medicine program director Friday, so we can try to lay this all out to make sure I'm not trying to get an ICU rotation when she's trying to get an ICU rotation. So again, competing space also for the sleep rooms and the workstations. Another area, you're going to have more people there needing a workstation at work. So things that you need to worry about. Timeline, again, ours was too short. I would not recommend that for anybody, but definitely laying out your timeline. I know. He just smiled. Medical library, that was one of my challenges. I really worried about that. And then I picked up the phone and I asked Chris, hey, you have a medical library. Can we use that too? Sure. So, not being afraid to ask and partnering with the people you need to. We have a small one at the local hospital that we're going to be working out of, but I wanted more robust facilities for that. Incorporating residency requirements into our existing policies. Again, that was really going through all our existing policies and seeing whether we met these needs, whether we needed a separate policy, how we needed to integrate everything. I think another challenge is, because we are doing it so quickly, is giving people enough time to give us feedback on our policies and procedures. So the GMAC committee really had to work quickly. And then just designing your program to meet all the requirements. Again, I just kept that requirements book open and just kept making sure everything we did met a certain requirement. Surprises, definitely the support we received. I was very happy that didn't have any problems. Of everybody I asked, even from all the specialties of both required and unrequired specialties, I only had one no in that whole time. And even the one that said no said, not now, I'm really busy, but by the time you start, come after me again. So he was open to considering it. And then also realization that we actually did a lot already in our organization, which you'll probably find that, as an FQHC, we have all these requirements for risk management and quality. And so a lot of this was already there. You just had to tweak it a little for the residency requirements. And just the commitment and excitement that we received during the whole process, a lot of people were very excited that we were doing that. I think people in the community realized there's a shortage of physicians, and they really thought this was a great idea. A little bit tempered, and people said, do you really think you're going to train internal medicine physicians that will not go into specialty? And I said, well, we'll try. We're going to see. Either way, they're going to get some experience here in the community, and then maybe at some point, even as they specialize, they'll come back. Takeaway point, I guess, really need the full support of your governing body. Have them on board from day one. You do need to submit with your application that their commitment to the program. And understand that your success depends on your relationships, the ones you have now and the ones that you're going to be developing with your partners. The importance of identifying the key players who you have lead your program is key. I know I went through the residency program I went through because on my interview, I really connected with the program director and knew that was the only place I wanted to train at. So I think who that person is really important, and that they understand your environment. And then really understand the requirements of residency, working, and learning environment. So read the manual and look at all the requirements that you have to meet. We have a little bit of benefit because we actually have residents in our clinic now, and so we basically, when we look at productivity, we don't even look at the residents' productivity. I don't present it. We don't look at it. I figure the program director knows they need to meet their requirements. She's on that, but I see them here to learn and not as extra encounters for us as an organization. And so you really need to think along those terms, because it's not that you're going to have all this free labor. It's not that at all. Really, they're here to learn. And if I were to fill full-time positions into those same offices, we'd probably have more encounters. So it's all about workforce development and about them learning. And then implementing your GMEC meetings right away and annotating the minutes. Also, keeping on schedule. You have to have a minimum of one per quarter to meet otherwise you're out of compliance. So in fact, I'm going to call one this month because I need to have one for this quarter, even though I don't have anything new to report yet. Well, I guess I attended training, so we can talk about that. But so you just have to keep on schedule for those.